Hi folks, I'm Dr. Ed Beyer. Today we're talking about reason number 8 of 22 on how our thyroid function can be depressed. Traditional medicine looks at one way. Functional medicine, we want to look at all the different ways. My typical thyroid patient that comes to see me has at least 3 or 4 of these 22 ways. But this is reason number 8, and it's a very common one that I see, and that is low progesterone. In our thyroid gland, we have this enzyme called thyroid peroxidase, or TPO, and this enzyme needs a certain amount of progesterone for it to work. Now, a lot of females will notice that when they're ovulating, they get a little spike in metabolism and a spike in their temperature, and they know when they're ovulating. The reason for that spike is because when a woman ovulates, progesterone, you get a surge of progesterone, and it causing an increase in thyroid output, which causes that increase in temperature. And a lot of people don't know that. But so progesterone upregulates this enzyme. And so low progesterone is a very, very common cause for low thyroid. What I want to do today is get into, well, what would cause low progesterone, especially in the female? The number one cause that I see in females is birth control pills. Now, we always hear that birth control pills are benign, they don't cause a lot of problems. Let me tell you, they cause a lot of issues that your OBGYN will not tell you. Synthetic hormone contraceptives, whether it's the pill, which is usually what it is, or an IUD, or Depo-Provera shots, or inserts, whatever someone's doing, they create a situation where the female loses the hormone surges and the levels of estrogen get higher in the body, tricking the brain into thinking that the female is pregnant. So there's no ovulation. When a female does not ovulate, the follicle in the ovary does not produce an egg, and therefore what's known as the corpus luteum, which is the follicle minus the egg, is never formed. It is the corpus luteum in a female in the second half of the cycle that produces gobs of progesterone, preparing the uterus for pregnancy. So we see this flattening of the progesterone levels, especially in the second half, or what's known as the luteal phase, due to the lack of corpus luteum. That it causes low progesterone, and it also causes estrogen dominance. Now, what else, when you get into this estrogen dominant situation, when a female is on the pill, estrogen dominates, there's too much estrogen, and that slows down the ability of getting the active form of T3 into the cell. High estrogen also deplete, or actually the pill actually depletes zinc levels, which can decrease the conversion of T4 to T3. So there's many ways that birth control pills really shut down thyroid function. And it's one of the reasons why a lot of females, when they go on birth control, they gain weight and they lose hair and they have all these symptoms of low thyroid. Now, another cause of low progesterone are the adrenal glands being fatigued. A female starts to decrease their progesterone levels in their early 30s. So by the time a female goes into menopause, which is the average age is 51, they actually are producing 70%, give or take a few percentages, less progesterone than they were in their early 30s. The adrenal glands are there to pick up that slack and produce more progesterone for females. But if the adrenals are fatigued, that doesn't happen. Another reason for low progesterone is the hypothalamus, which is the area of the brain that tells the ovaries and tells the adrenal glands to produce progesterone. They secrete a hormone called luteinizing hormone. But there are many conditions that shut down the hypothalamus and shut down the ability to produce this luteinizing hormone, which tells the ovaries to make progesterone. Things like inflammation. And inflammation can be due to poor essential fatty acid ratios. So they're eating too many bad fats versus good fats. I go over this in my long video on female hormone imbalances. Food sensitivities cause a lot of inflammation, causing the hypothalamus to shut down. Leaky gut is a gateway to inflammation and autoimmune disease. Chronic infections, whether they be oral or gut infections or herpes simplex, cold sores, things like that. And then just the standard American diet is extremely inflammatory. So those are some of the reasons why we can suffer from low progesterone and how the impacts of low progesterone on thyroid function. I'm Dr. Ed Beyer. Hope that helps. Have a great day.